Welcome to our presentation on breast cancer-related lymphedema by Jasmine Jaramillo, Grace Quindara, Sabrina Lathrop, and Hannah Ryan. What is lymphedema? Lymphedema is when there is a blockage in the lymphatic drainage system, causing swelling in any part of the body, but usually in the arms or legs. It affects both women and men, however, women are more at risk. Signs and symptoms include swelling in the affected area, tender and or firm skin appearance changes, non-pitting edema, stemmer signs. Primary lymphedema is when genetics are causing the altered development of the lymphatic system. Secondary lymphedema is the result from obstruction or damage.
We decided to narrow research on breast cancer-related lymphedema, which is a common result of treatment for breast cancer involving the removal of lymph nodes. Breast cancer-related lymphedema is defined as a 10% or more increase in relative volume change, which can be measured via circumference. Lymphedema affects 1 in 5 individuals treated for breast cancer, and women treated for breast cancer face a lifetime risk of developing lymphedema.
The pathophysiology for lymphedema includes the lymphatic system, which returns protein molecules to the bloodstream. It carries intracellular fluid into the bloodstream, and the bulk of the intracellular fluid is removed to the bloodstream via the venous system. It occurs when the transport capacity of the lymphatic system falls below the level of the normal lymphatic protein load. This creates an abnormal accumulation of protein-rich lymph in the tissue.
There are 4 stages of lymphedema. The first stage is called the latent stage, where there is no edema present. Stage 2 is the reversible stage, where soft pitting edema develops. Stage 3 is called the spontaneous irreversible stage, where there is increased swelling, fibrosis and sclerosis have developed, and increased risk for infection of the tissues such as cellulitis is present. Stage 4 is the elephantiasis stage, where the swelling is extreme, skin thickening with wart-like growth and extensive scarring, and the risk of erysipelas is high.
Societal impacts include the inability to return to work, as lymphedema is one of the most debilitating complications of breast cancer treatment. Another societal impact is healthcare spending. Lymphedema is a major driver of healthcare utilization in breast cancer survivors.
For the prevalence, 1 in 5 women who survive breast cancer will develop lymphedema. Primarily, lymphedema is rare, affecting 1 in 1,000 individuals. Primarily, lymphedema affects women twice as often as men. Secondary lymphedema is the most common cause of the disease and affects approximately 1 in 1,000 Americans.
Some risk factors that can lead to lymphedema include older age, excessive weight or obesity, mobility issues, breast cancer treatment such as axillary lymph node dissection, regional lymph node radiation, infections or trauma, and medication side effects.
The impact on occupation. Impact on social participation includes statistically poor social well-being, negative self-identity, perceived social abandonment, social isolation to avoid scrutiny from others, public insensitivity, and romantic relationships are impacted due to a perceived diminished sexuality. Lymphedema also has a significant impact on ADLs and IADLs. The following are impacted due to limited range of motion and intolerance of heavy lifting. These include grocery shopping, meal preparation, heavy household cleaning, yard maintenance, laundry, and childcare. Impact on the workplace also includes this inability to lift heavy objects, unsupportive work environments, employers' lack of knowledge, which contributes to lack of compensation for these individuals, and an unwillingness of employers and coworkers to assist with job responsibilities.
Lastly, lymphedema can impact health management. It can have a negative psychosocial impact in individuals. Patients can experience negative emotions such as frustration, anger, anxiety, fatigue, and depression. Psychological distress can decrease physical activity and treatment. In one of our articles called Psychosocial Impact of Lymphedema, a systematic review of literature included that lymphedema and associated symptoms, including swelling, heaviness, tightness, firmness, pain, numbness, stiffness, or impaired limb mobility exerted a negative impact on physical and functional well-being, resulting in diminished overall health-related quality of life. This is relevant to occupational therapy, as occupational therapists can help people regain, develop, and build skills that are essential for independent functioning, health, and well-being in the home and community. Occupational therapy professionals have unique expertise in evaluating participation and enabling engagement in meaningful occupations. OT's main goal is to minimize the amount of edema in the affected area, maximize client participation in ADLs, maximize home management program to facilitate participation in valued daily activities. OTs can help provide education to family members and caregivers to support the client during both treatment and maintenance phases. OTs can help facilitate adaptations and performance patterns for safety and prevention and increase the quality of life.
We will now talk about the treatment for lymphedema. For general treatment, this includes the mobilization and removal of the interstitial fluid and the reabsorption of the stagnant proteins. Techniques require attention to massage, external compression, exercise, skin care, and infection prevention. If left untreated, long-standing lymphedema predisposes the person to infection and the possibility of developing lymphangiosarcoma. We have 3 assessments that are presented that can be utilized for lymphedema. First, we have the lymphedema assessment evaluation form. This is completed by a CLT, which assesses impairments and ADLs and also assesses long-term goals and short-term goals. Second, we have the lymphedema life impact scale, which is shown here to the right. It is a comprehensive lymphedema-specific instrument to assess the effects of lymphedema in any extremity. It assesses physical concerns, psychosocial concerns, functional concerns, and infection occurrence. We lastly have the disability of the arm, shoulder, and hand, which evaluates disorders and measured disability of the upper extremities and monitored change or function over time.
Hi Hannah. Today we're going to go over the lymphedema life impact scale. So what this is going to help us occupational therapists do is assess the impact lymphedema has on your life currently. We're going to go over categories such as physical concerns, an example of that being the amount of pain associated with my lymphedema is 0, no pain, 4, severe pain, and you would pick 0 to 4. Next category we would go over is psychosocial concerns. The example question here being lymphedema affects my body issue, how I think I look. 0 is not at all, while 4 is completely. Thirdly, we'll go over functional concerns. An example of that is lymphedema affects my ability to perform self-care activities such as eating, dressing, hygiene. 0, no interference, where 4 is interferes completely. And lastly, we have a scale assessing your infection occurrence.
Interventions for lymphedema include complete decongestive therapy, which includes 4 aspects, the first being manual lymphatic drainage, the second being compression therapy, which includes a reduction phase and a maintenance phase, the third component being skin care and education, and the fourth being exercise and mobility. Another possible intervention is including precautions and safety. One of our interventions is utilizing manual lymphatic drainage, which is a gentle form of massage used to relieve pain swelling in the arms and legs. It assists the flow of lymph by enhancing the natural pumping effect of muscle contraction. It is a 2-step process, the first being clearing, which releases lymphatic fluid in your tissues, and the second being reabsorption, which moves your lymphatic fluid to your lymph nodes. Alright, so today I'm going to be showing you some self-massage techniques that you can do on your own for some lymphatic drainage. So if you're experiencing any excess swelling or pain, you can go ahead and do this yourself. So if you are experiencing this within your hand, then you can go ahead and start by using your other hand to just firmly but also gently start moving that fluid out from this area. And you're going to want to bring that up your arm And you're just gonna continue that. Yes, that looks good. And you can even do under the arm as well, bringing that up your arm. And then once you get that up your arm, again, using that firm but gentle, then you're going to bring that around and down. Excellent, yep, down. And then if you're experiencing any of that swelling within your breast, then you're just going to do the same thing, firmly but gently massaging down. You want to make sure that you're moving that fluid away from the affected area. Excellent. Do you have any questions regarding this?
Yeah. How many times do you want me to do this?
Okay, so you can perform this daily on yourself, and if it's pretty severe, then you can do it for about 5 to 10 minutes just within that affected area.
Another intervention is compression therapy. Compression is vital in reducing and maintaining the size of the affected limb. This can be achieved by pneumatic compression devices and compression garments. In a study in 2020, pneumatic compression therapy combined with manual lymphatic drainage leads to improved clinical outcomes, quality of life, and functional status for patients with clinically significant lymphedema. There are 2 phases within compression therapy. First, we have the reduction phase. During this phase, we are aiming to reduce the limb size, soften hard tissue, stop the weeping and fluid leakage, prevent the skin breakdown, prevent infection, prevent loss of mobility, and removed only for hygienic purposes and skincare purposes. Secondly, we have the maintenance phase. This is done after the reduction phase. It keeps the tissue soft, it aids in fluid return, and there's multiple garment options in this phase for the preference of the client. It's very important to note that compression garments alone will not cure swelling. Compression garments in tandem with other lymphedema treatments will prove to be the most effective. Compression products come in several different options such as sleeves, socks, shirts, and much more. Alternatively, occupational therapists may apply lymphedema wraps. Due to the nature of lymphedema wraps not being one size fits all, becomes an individualized and client-centered treatment. Hello, today I will be demonstrating how to apply a bandage for individuals with upper extremity lymphedema. This would be used in the maintenance phase. Please check with your occupational therapist as to how long you are to keep these bandages on. Firstly, we want to make sure that the arm is clean and dry. We're going to next apply this liner. Keeping our arm out to the side, we're going to rotate our arm internally just a bit. Going to grab onto the ACE wrap and wrap around the knuckles. We're going to wrap 4 times. Now on the 4th time, we're going to wrap under the thumb and then back in between the thumb and the first digit. And it is up to the discretion of your occupational therapist as to how many times you do this. After that, we're going to start overlapping by half the width, starting at the wrist, applying the same amount of stretch. When you get to the end of the bandage, you're just going to tape the ends and you're going to start on your new bandage. When we start our second bandage, you're going to just want to start at the wrist. So grab the ends and start overlapping by half. At this point, you can rest your hand on the table for better leverage. Again, apply the same amount of stretch as we come up the arm. It's really important that you make sure that the more proximal we get on this upper extremity, we don't increase in pressure. We want the flow to be towards the body, not away. And again, fasten the ends with a piece of tape. Now you have your completed lymphedema wrap. There are a few concerns to keep in mind when wearing this wrap. If at any point that the wrap starts to feel significantly uncomfortable, contact your occupational therapist. It's very important to periodically check on the skin integrity and to make sure there are no infections and the like that are occurring behind the bandages. Other things to note is you can lubricate your skin before applying the bandage. You must check if there's any cuts or wounds or sores on the skin before applying the bandage. As occupational therapists, we can enhance the autonomy of our clients, in this case, those who acquired lymphedema as a negative sequelae of breast cancer. Multitudes of detrimental implications result from breast cancer treatment alone. Educating clients with self-wrapping techniques reestablishes a sense of independence in which clients can manage their lymphedema in the comfort of their own home.
One of the simplest ways you can help prevent lymphedema is maintaining your skin barrier. Anything that penetrates the skin barrier or causes skin breakdown is a possible entry point for bacteria to get into your system and potentially cause a local skin infection and ultimately trigger lymphedema. An important intervention for patients with lymphedema is educating them on skincare. This can include applying moisturizers daily to prevent chafing and chapping, but ensure that the lotions are fragrance-free. Always apply sunscreen before going outside because sunburns can cause an extra burden to the lymphatic system and increase swelling. When performing IADLs, be sure to wear gloves to prevent skin damage. Use electric razors instead of razor blades to prevent skin damage. If you do get a small cut, scrape, or bite on your arm and hand, be sure to clean it well with soap and water and apply an antibiotic cream. Okay, so here's an information sheet about skincare. It basically gives you a general overview of how to properly take care of your skin, what you can and you cannot use.
Okay, I do use Aveeno to moisturize. Is that okay?
Yes, so you can use Aveeno lotion as long as it's fragrance-free. When you're showering as well, you can use soaps as long as they're fragrance-free.
Awesome.
And I also noticed that you like to garden, so when you do garden, just make sure that you're wearing gloves. Also, with this Arizona heat, my advice for you is to use a higher factor of sunblock, at least more than SPF 25. That's all I have for you today. Do you have any questions?
No.
All right, so I'm gonna give you this to take home so you can reference.
Although doctors and other healthcare professionals previously recommended that exercise was avoided for individuals with lymphedema, current research demonstrates resistant exercise has no negative impact on breast cancer-related lymphedema and is actually shown to be beneficial in reducing it. For a home exercise plan, this would be completed once a day. Precautions would include wearing the arm compression garment during exercise, starting conservatively, slowly increasing resistance and exertion. It is also recommended that individuals rest between sets, stay hydrated prior, during, and after exercise, periodically take deep abdominal breaths to facilitate drainage, incorporate warm-ups and cool-downs, and avoid temperature extremes. Exercises will be performed for 8 to 10 reps with a 3 to 5 pound dumbbell if tolerable. These exercises include elbow flexion, elbow extension, shoulder horizontal adduction, shoulder abduction, and shoulder flexion.
Guys, now that we've gone through your precautions, we're going to go over your home exercise plan. So each exercise will be done 8 to 10 reps, but for the purpose of this, we're going to go through each exercise, do a couple reps to make sure you understand how to do it and it's pain-free. So I'm going to give you this weight, and we're gonna begin with elbow flexion. So seated, you're gonna hold the weight in your arm or in your hand and bring your hand up and flex. Those look great, so we'll move on to elbow extension. So if you wanna lay on your back, I'm going to have you bring your arms up to a tabletop position. Perfect, and then bring your arm up so your hand up so your arm is straight, just like that. Okay, great. Now I will have you come back to seated position and we will do shoulder horizontal adduction. So I'm gonna have you hold the weight out like this. Yep, and then just bring your hand into your chest and just bend at the elbow. Perfect. We're now gonna do shoulder abduction. So I'm gonna have you start with your hand down and then come up to about 90 degrees and then back down. Perfect, do a couple more. And we will lastly do shoulder flexion. So I'm gonna have you have the same starting position and bring the weight up to shoulder height, 90 degrees again, just like that. All right, perfect.